Heart attack symptom in women. Are the symptoms of heart attack in women different? Yes, they are. That's why I am going to discuss today the unusual symptom of heart attack in women. The awareness will surely help. If you are aware, you can take steps at the earliest and you can prevent the heart attack way before it happens. And even if it happens, you can reach to the hospital at the earliest possible. And then the outcome of the disease will be far, far better than if you reach the hospital at a later stage. So, women, 1 out of 5 have very unusual symptom. They have symptom like feeling extremely fatigued, sweating, upper abdominal pain, gas or acidity pain, feeling anxious more than usual, sweating, mild degrees. These symptoms can happen in a very mild way in women. In a scientific study, it has been shown that women who are going to have a heart attack after 7 days or so, they showed the symptom of lack of sleep, the inability to fall into sleep. They wake up frequently in their sleep and they feel extremely fatigued even after a complete full night of sleep. This is the warning they may have. And then after that, when the heart attack happens, it comes with 20% of the time with very mild symptoms. So women should be more sensitive. And they should know that these mild symptoms can be the symptom of heart attack. Apart from chest pain, shortness of breath, palpitation, and loss of consciousness, I have already discussed in a heart attack symptom video. And they should be more conscious about these mild symptoms because they have 30% more death rate. Women have 30% more death rate than the male counterpart. They have higher chances of complications in hospital. They have higher chances of bleeding in the hospital. Not only that, they have higher chances of readmission in the hospital within 30 days of discharge than the male counterpart. So being aware about the mild symptom, seeking medical advice at the earliest can save a lot of lives, a lot of complications, right? Awareness will help. Women should be aware about this mild symptom. If you are feeling extremely fatigued, anxious more than usual, you are sweating, you are having acidity, you should go ahead and seek medical advice. Do not delay more than 30 minutes. Try some home remedies, 15 minutes, 10 to 15 minutes, and then do not delay. It doesn't worth it. Because the more you delay, the chances of complications rise steeply. And if you are having some warning signs like inability to fall asleep suddenly you start waking up in the middle of the nights multiple times and feeling fatigued even after a good night's sleep, go ahead, have a checkup. It doesn't worth it. Do not hide from it. Hiding the fact, not facing the fact that you may have a heart disease or heart attack doesn't serve any purpose. It's not useful. Rather, getting diagnosed at earliest phase so that you can take preventive measures, or if something has already happened, you can seek the earliest medical advice and treatment. will save your life, will save you from years of complications. So please be aware of the symptoms, the unusual symptoms, and the warning sign, and take medical advice at earliest. Am I making sense? Hopefully so. Who are the women who actually have a higher risk of having heart attack? I am going to tell you the risk factors of heart attack in women, so that those who are having the risk factors can be aware and more sensitive to the heart attack symptoms in women. Not only that, they should consider a regular checkup and earliest medical advice. So who are the women having higher risk? Number one, if they have a family history of heart attack, of a male relative having a heart attack less than 55 years of age, a female relative having a heart attack less than 65 years of age, that is first-hand relatives. If they are obese, 5 times more risk of heart attack. If they are diabetic, 4 times more risk of heart attack. If they are smokers, 2 to 3 times more risk of heart attack. And here is the news. If you are diabetic and obese, then the thing doesn't get add up. Means diabetes 4 times and obesity 5 times. So 5 plus 4, 9 times more chances of heart attack. No. It's 5 into 4. So if you are diabetic and obese, you have a 20 times more chances of having a heart attack. And if you have a family history of like this, your father have a heart attack less than 55 years or mother had a heart attack less than 65 years, you should be more sensitive to the atypical symptoms that I mentioned. Have a regular checkup. Prevent. Obesity is preventable. Type 2 diabetes is preventable. Smoking is a lifestyle issue. You can solve it. These are modifiable. So you can take the steps forward for prevention and remain sensitive to the atypical symptom so that you can prevent at earliest. Not only that, you can seek the medical advice at the earliest phase to prevent the undesired long-term complications. And do not hide of facing the fact that you are at the high risk zone. Face it. Then take the steps to prevent those which are preventable and have a regular checkup. Be sensitive to the atypical symptoms. And that way, lots of life can be saved. And if this video can save few lives, can make you more aware, then the purpose of making these videos and taking this effort will be served. Thank you for listening. I wish you best of luck.